Hey, Shalene, it's Dan Toner. Hope all is well. So, if you can hand this out to the employees, that would be great. What we have on screen is you have basically four different plans from the member health plan. Member health plan, remember, uses the Aetna network. The existing plan that you had last year was called Plan S, and it's called a health savings account. Then you're offering Plan M, Plan P, and Plan W. As you know, you're paying 100% of the cost. So if you want to share this with your employees, it's important to know that for new enrollees, they can participate in any of these four plans at no cost. So the question is, what do they think their better coverage is? If they're a single, the deductible, the first number matters as the single deductible. And if they have dependents, they could owe the second number. So if your employees are coming onto the single, they don't have to worry about the second one unless they have one or more dependents. The first plan is an HSA, which means you do not have a doctor copay or a pharmacy copay. You owe the first $2,000 if you're a single, or the first $4,000 if you have dependents. Once you meet that deductible, then you pay a $30 copay to the primary, a $50 to the specialist. At the pharmacy, you owe $15 for generic and 50%. If you go to the hospital, you owe a $500 copay. And you see this AD after deductible. That means they have to meet the deductible first and then pay the copay. This is a great plan for those that want to open up a health savings account. Because it's a high deductible plan, the employees can put away their own money pre-tax into a health savings account. We can help them do that. There's another health savings account called Plan W, which is just a higher deductible of $3,000 and $6,000. So if I'm an employee wanting an HSA, I'm sure most of them will take the Plan S, which has a lower deductible than Plan W. We also wanted to offer, remember, two options that do not have a high deductible, and that's Plan M and Plan P. If you notice with Plan M, it's got no deductible. It's got the first two visits to a primary care. It says Tier 1. What that means is if your doctor is in the Aetna Whole Health Network. So when you go on Aetna's website, aetna.com, and you look up doctors, it asks if your doctor accepts and participates in the Aetna Whole Health, you're at Tier 1. The first two visits are free, and then every sick visit to your primary care is $25. If you go to a Tier 1 specialist, it's $50. But you'll notice there's two levels of coverage. If the doctor is in the Open Access Select, which is a slightly larger network, you're Tier 2. So a good example on this Plan M is it provides you very rich coverage if you're using the smaller Aetna Whole Health Network. That means I get Tier 1 benefits. So the plan is like an incentive built in. So if I'm using Aetna Tier 1, Aetna Whole Health Networks, I have a $25 for my sick visit, $50 for specialists. I owe $500 if I stay. Doesn't matter how many nights I stay in the hospital. I don't have a deductible, and I don't need to pay a percentage. So this is probably the richest plan offered, as long as you're okay with using the Aetna Whole Health Network. The other plan is what's called the Aetna Choice Plan P, which is the largest network of doctors. It's a nationwide network of doctors. It's got a higher copay, $50. Deductible is waived, so its primary care is $50, specialist is $50. It's got a pharmacy copay at the bottom, but now all of your hospital and surgery, there's a $5,000 deductible. The employees owe 30%, but they can't spend more than $8,550 for the year. So sort of the concept here is this is the largest network, and it should be more expensive. And to offset the costs, Aetna is having a higher deductible just for hospital and surgery. This is probably the richest plan with the smaller network, if your employees are okay with that. This is a health savings account that lets the employees have a high deductible and put away money pre-tax. So these were, basically the three plans that we did to try to accommodate. Okay? Any questions? 732-888-5554. Let your employees know they can ask for me. I hope that helps.